Namaste, everyone. A very good afternoon to you all, and welcome for today's wonderful and the most informative live session, Oral Health Care from Childhood, which we are going to conduct with Dr. Ishan Dhruv. काफ़ी सारे पेरेंट्स ने हमें हमेशा अप्रोच किया कि बच्चों की ओरल हेल्थ जो है उस पर कब ध्यान दें, कैसे ध्यान दें, क्या चीज़ें ध्यान में रखें. सो टुडे वी हैव एन एक्सपर्ट विद अस. So before Dr. Ishan Dhruv joins, I would like to introduce him. Of course, he needs no introduction because he has a beautiful clinic with the name of Dr. Dhruva's clinic. So basically, Dr. Dhruva is the director of Dr. Dhruva Dental and Cosmetic House, MDS, pediodontist and implantologist, gum surgeon, D. Laser, Vienna University, Fellow of International Implant Foundation, Germany, Master in Facial, Cosmetic and Skin City, India, working as a consultant in Bhavnagar, Baroda and Pune. So if you have any questions, please drop down in the comment section box. And here I would like to add Dr. Dhruva on board.
Good afternoon. Good afternoon.
Good afternoon, Dr. Dhruva. How are you? So there are a lot of questions that parents keep asking us. So I will just ask those questions. But if as a parent you have any questions regarding the oral health care, you can definitely drop down in the comment section box and we will definitely try to incorporate that in our live session. I think there is a network connection. Yes, I will add him again.
I hope everything is clear now. I'm audible and visible as well.
Perfect, Dr. Ishan. So before you joined in, I introduced you and
Yeah.
I also informed
So
the
I would also
parents
like
that what we are
to
going to
congratulate
talk
and
today.
thank Small Wonders. So it shows your commitment towards
So
not only building a mental health, but also physical health as well. And it shows that you are interested in child's complete well-being. It's very important to have two things clear in your mind from the child's
thank you so
perspective,
much.
not to a fear of a dentist. When we were growing up, we were told, so many scary things about dentists. So we had a fear of dentist in our head. And second, to have the importance, to know the importance of oral health, because that connects to your general health. So today we're just going to emphasize the basic things what child needs to know, and also the parents when what they need to watch out for. So in between, you have questions you can ask. Sure.
Wonderful. Yeah. So you also have prepared a wonderful PPT. So I
Okay,
think we'll
ma'am.
start with the
I'll just
PPT and
quickly
towards the
go through
end, I will pick
the
up questions if there are any.
PPT.
Done. Yeah.
Okay, ma'am.
I will mute myself so that there is no disturbance.
Okay. So let me just quickly introduce our setup. We have setups in Pune and Bhavnagar. Name of Dr. Dhruva's Dental House. I've already gave my introduction to everyone, so not repeating myself. We have a wonderful team of doctors. So there are specialists in all the field available. This is a Bhavnagar setup. So we have a dental operation theater as well. That is one of the first kinds. So you see the setup here that is specially designed for kids, because kids, if they need a extensive treatment, might not be able to undergo a treatment like adults. So we need to have the special assistance, special facilities for them. We can anesthetize them. We can do the procedures in general anesthesia also. So you create a setup considering that in mind. This is our Pune setup, and this is our team of doctors and specialists. So we have a child dental specialists, we have a root canal specialist, braces specialist, cosmetologist, prosthodontist, myself is implantologist, gum surgeon. So we try to give the best quality care to our patients. And there are so many things in dentistry, not only the treatment filling part, but we have audio analgesia, child dentistry, etc. as well. So the topic is oral health education. So we can celebrate to start with this month as Oral Health Awareness Month. So whatever doubts, queries you have in mind, try to solve them in this month only, rather than waiting for the problem to occur on a bigger scale. So just parents and kids, you can just go through the slides. So when you see these pictures, you feel they are good looking? No, right? So another slide. So you all know these actresses. They all look pretty otherwise, right? But do they look pretty right now? No. The reason is, yeah, now they look pretty. So even the prettiest people need good teeth to look good. So you're required for your overall personality as well, not only for health. When you meet someone for the first time, you see their smile first. So when you go to take awards at Small Wonder also, the teachers are going to notice your smile first. So teeth are very important kids for you, right? And for that, you need oral health, very important. In that, you have teeth, you have your lips, you have your cheek, your tongues. So you have to take care of the whole mouth. How you should do it? To begin with, brushing. First step is good brushing. And good brushing technique is also important. If you do it in a wrong way, you might end up damaging your teeth rather than cleaning your teeth. So a lot of parents in the dental camp, they had a query, how should we teach our kids brushing, right? So here is a small clip I'm going to play for all the parents and kids to see. This is the rough size you should take, like the paste size, and this is how the technique follows. So you have to basically divide your mouth into six parts. Upper three parts, front side, right side, left side. Same lower, front side, right side, left side. And then you have to brush for the kids below 6 years. Small round motion brushing is important rather than doing horizontal, aggressive, forceful brushing. So here they are showing that you should do it in the front area, you should do it in the side area, you should do it from the inside area as well, also on the chewing surface, but in a small round motion rather than doing aggressive horizontal brushing. Horizontal brushing can cause damage to your teeth. This is a very simple technique, and yes, you should brush twice daily. So this technique you need to follow properly. Half of the problems will be solved if you do good brushing only. Okay. After the brushing, teeth cleaning, tongue cleaning obviously is very important. You have tongue cleaners. If you don't clean your tongue, then a lot of bacteria stay on your tongue, and that can go into your system and cause damage. So the tongue cleaning with different tongue cleaners are important. So another question one parents had in the camp. So I'm just trying to cover the questions they had. When do the teeth start coming? Like there are two sets of teeth. One is milky teeth, and one is permanent teeth. Milky teeth start coming at the age of around 6 months. Up to 2.5 to 3 years, all your milky teeth come. So around 20 teeth are milky teeth in the first primary age. After 6 years, your final teeth start to erupt. And first are the lower anterior teeth. Okay, so the lower anterior teeth are the first teeth to erupt, then the behind molars, the bigger teeth start coming. So roughly you can say that dentition for final teeth begins at the age of around 6 to 7 years. And it goes on till 11 to 13 years, except the wisdom teeth. Wisdom teeth can come from 17 years up to later in the age. So this is the whole teeth eruption cycle. So when teeth are growing, we need to take extra care to maintain your permanent teeth. And yes, your milky teeth are also very important. Some teeth have parents had questions that milky teeth are going to fall. So why we need to worry so much about it? But milky teeth are designed to stay at least till the age of 12 to 13 years, as we saw. In between, if we don't take care, they are very soft and small in size. They can have cavities faster. So if you notice this kind of black dots on your kid's teeth, that means the cavity has begun to erupt. So you have to stop at that moment only. And yeah, tongue cleaning, teeth cleaning in kids are also very important. People say that teeth cleaning can cause weakness in the teeth, can cause sensitivity. That is a myth. So if you don't get your teeth cleaned, then the gums will swell up and then the problems start. So yes, to avoid all the problem, you should regularly visit the dentist and get your teeth cleaned at least once in 6 months. Another very like important myth like people have that only sugar can cause cavity. No, it is not like that. Even your normal roti, chapatis, that can also cause cavities. The question is how it happens. The answer is simple. Don't let any food stay on your mouth for a longer time. So if you eat anything, try to rinse it out after you are done with the meal, or at least brush after that, or at least have compulsory night brushing. Okay, it should not stay longer on your tooth surface, then it can cause cavity. So if you clean your teeth, then you can avoid cavities even after eating chocolates. But cleaning is important. That's a good news for kids. But they need to clean properly, right? And they have to observe. Parents need to just check their teeth, and at least they can visit the dentist once in 6 months. These are the early signs of cavities. So if you have the cavities in the early age, we just remove that black dot that is called cavities, which has a lot of bacteria. And if we don't remove that, it can go into your system. It can cause other disease also. It can go to a permanent teeth as well. So these cavities need to be filled at an early stage to avoid bigger problems. And when the pain starts, that means it has gone deeper into the nerve. That time we need to do the root canal. But root canal is available for kids also. We do proper painless root canal for kids also and give caps also. So you have seen a lot of pictures like this. So why this happens? This is not natural, right? So this usually happens because of long, like bottle caries, you can say for this. If the child has a habit of keeping the milk bottle in mouth for a long duration of time. Some kids, they have a habit of keeping the bottle overnight in the mouth. So these are all nursing bottle caries, especially in the kids. Even at 2 years of age, we have discovered that the child has lost all their teeth because of the cavities. So we need to educate the parents about it, that do not keep the milk bottle overnight in child's mouth. Okay, do not use that as an excuse that the child doesn't sleep without it. But if you do that, you're 100% most likely to damage your kid's teeth. So avoid this habit. Rather, you can, visit the doctor if there is any problem. Kids, you start noticing this blackness in your teeth at an early age. Visit your dentist so they can advise you at the right time. So we already cleared the myth. Main thing is visit your doctor. Don't worry about it. And a lot of patients, even in the camp, also we noticed that they were more conscious about your child's alignment of the teeth. Parents were very aware nowadays, so they started noticing that teeth are not erupting at the right, in the right direction, or you can see the teeth are coming behind one behind each other. So there is a special age for every tooth to fall. Okay, if it falls before that, if it's decayed or if it's carious, then your new tooth will come in a different direction. So your maintenance of your deciduous or milky teeth is that's why very important. If it falls early or late, then your new teeth will come in a different direction, right? Don't, but even if that happens, don't worry. We have treatments for that also. We have braces treatment. We have nowadays tooth color braces, and even newer treatments are called Invisalign. They are all aligners. They are transparent braces, invisible braces. You can say that. So this treatment can also help your alignment. And this is a very important point I want to notice, that is the fluoride gel application. We give calcium in our diet to kids, right? In banana and milk, everywhere you have calcium. We give vitamins in vegetables, etc. This thing can make your teeth stronger, but the fluoride is the only like element which prevents the cavity. That is not available in diet regularly. It is only available in water, and that too in a limited amount. So when your teeth are growing, that time we have a specially designed fluoride gels, strawberry flavor, mango flavor, etc. So these are all very fluoride gels available. Simple 10 minutes of treatments every 6 months till the time your permanent teeth are erupting. Between 6 to 12 to 13 years can make your teeth very strong. It can prevent the cavity. It can make them caries resistance. So this is a very simple step. If you are aware about it, then you should go for that fluoride application treatment. So these small things can, make your teeth stronger for life. A lot of kids have a lot of abusive habits also. Sometimes, like you have thumb sucking habit. you have a nail biting habit, you have a pencil chewing habits, they can damage your teeth. So especially thumb sucking can change the whole alignment of your teeth. Your permanent teeth will have permanent gap in this if that habit is not stopped at the right time. So we have special appliances. Even the nail biting can cause your damage your teeth. So we have designed special appliances which will break the habit. If your child has a thumb sucking habit or tongue thrusting, they tend to put tongue in between. Then it can damage the teeth alignment. If you notice that, you can come for this habit breaking appliances. We will design the appliance for you and it will stop the habit. The child also will take stress after growing at certain age. Then we have special guards to prevent their clenching. These are all the habit breaking appliances. Main thing is to know the habit. Yes, and for the kids, avoid having cold drinks, night snacking, intermittent snacking. Rather have two-time proper meal or and two times breakfast. Do not eat in between if possible. And even if you eat, you cleanse your teeth regularly or at least gargle your teeth immediately after eating. Because your teeth problem can lead to multi-organ problems. It can affect your whole health, whole body, whole system is affected by that. Right? So the oral health, if it's good, your systemic health will be good. And if oral health is not taken care properly, your systemic health will get affected. These are all the points we discovered that at least get your child to brush twice, regular visits to dentist, fluoride application, good food, no cold drinks, avoid that, and visit your dentist twice. And even if you come to the dental clinic, don't worry, we'll not treat them like this. We have better design clinics nowadays. Okay, so we have painless facilities, we have a lot of advanced treatments available where we take care of the full teeth. We have implants. So now the dentistry has evolved so much, it has become absolutely painless treatment. It has also become more cosmetic. So we design the smile. A lot of parents are more aware at a very early age for their kids' look also, appearance also. That is a good thing. So we have options to correct them. And this is a very different treatment, which not many people are aware about it. It's called stem cell collection. You know that the stem cells are the future treatment, right? For any disease. They are all growing the stem cells, preventing for yourself. So there are two best sources of stem cell. One is when the child is born from umbilical cord, and the second is from your milky tooth or your wisdom teeth when it falls. So if you want to preserve the stem cells, we have stem cell banks also, which collects stem cells from the teeth. And we have done the tie up with Bombay Laboratory. So if you need to do it at an early age for your child, parents can contact us for this also to prevent their stem cell for future treatment. It can, you never know how healthy and how handy it can be for your child. Right. So mainly all these summaries we have taken, and thank you, Small Wonder, for giving this opportunity. It was lovely to interact with you all. Now, if you have any questions, you can ask.
So, Dr. Dhruva, first of all, let me congratulate you for wonderful presentation
Okay,
because
thank you.
all my questions that I had put down on paper, everything you've covered. And the best part, the best slide that I liked was ki how you all treat. You showed a
Mm.
man with a stick. So y'all are not means
Right, right,
generally,
right,
as you mentioned earlier, that children fear going to
right,
the dentist because they feel कि अभी
right.
जाके दांत में क्या करेंगे, and all kind of stuff. They are scared. But lot of things, lot of important things that you mentioned, I would just like to revive
Mm.
and
Right,
revisit those things. Is number one, you mentioned about
right.
brushing the teeth twice. You mentioned about cleaning the tongue because 2-year-old
Mm.
children, most of the parents, they
Right,
come to the school and they say, "Ma'am, इनको बोलना ना कल से brush करके आए." Parents are running behind them, bringing fancy
right,
uh,
mm,
toothbrushes.
right,
Sometimes they
right.
bring those finger toothbrushes, so that the mother
Correct,
can
at
put the
all.
finger
Right.
and she can. But sometimes children don't brush their teeth. And after we had that wonderful dental checkup, many of the parents came with the feedback कि मैम कुछ
Mm.
चीजें हमको
Correct.
पता ही नहीं थी, हमको
Right,
ऐसा लगा कि
absolutely.
दांत तो जब दुखना लगे ना तभी डॉक्टर के पास जाते हैं. So early, as you mentioned, that early intervention or when you
Yeah.
know early, it's the best sign of getting it
Mm.
treated. And
Right,
about the alignment that you mentioned about thumb sucking, there were a lot of
right,
parents who had
absolutely.
said that child sucks the thumb and the teeth, the front teeth, they come out. Though there are things that post you have this habit and you can treat them, but as you mentioned, you have an
Right.
instrument,
Yes.
that the child wears in the thumb, so that is a good thing. So almost
Okay.
everything, Dr. Dhruva, you've covered. There is one question I would like to pick up, that it's on the screen. If we want to preserve stem cell from the teeth, at what
Yeah, so you
age,
can
or
even
when the
when
teeth
your
falls by
first teeth
itself,
they
what
fall,
is the
that time
age to
also you can
preserve the
preserve
stem
them
cell of the
in
teeth?
the saline. You can contact us. We need to contact the stem cell bank, and they will come in a special container to collect that teeth. So there is a special way to collect it. But yes, whenever it falls, you have to put it in the saline. Don't keep it in an open environment. Even like starting from 2.5 to 3 years, this teeth will start falling at 6 years. So after that, anytime you can collect the milky tooth and you can put it in the saline and contact us immediately. Within 24 hours, it should reach the stem cell bank. Then it is more handy. Up to the age of 30 years is good. After 30 to 35 years, your stem
Wonderful.
cells start losing that potency. So they are called pluripotent cells. So they have a potential to generate different body cells. That's why they are called stem cells. Up to 6 to 35 years is a good age to prevent it.
Wonderful, wonderful. So I think as we
Right,
have our
definitely.
family doctor, we should have our family dietitian as well. Because I think because children, their food habits are so horrible that I think a
Right,
6-year-old or a
definitely.
4-year-old also
Mm,
needs cleaning at least once a year. Because you see those teeth,
mm.
itne gande. I mean,
Habits is
the
key.
mothers are,
Mm,
it's not that the mothers are not taking care, but the food habits are such. Plus, 2 times brushing is like, if you bribe the child
yeah,
also, कि तू मैं तेरे को ये दूंगी, वो दूंगी, तू brush कर.
right,
Night brushing is a
right.
challenge, let me tell you.
Yeah.
If you bring those electric brushes and whatever, वो 2-3 दिन ठीक है, लेकिन but I think if the
Mhm.
parents themselves, अगर मैं मेरी बात करूँ तो at times I am also lazy, to
Yeah.
brush my teeth
But
twice. So I
since
think
this kind
that
of
habits goes
sessions, so
from
it's that's why it's
generation to
named as oral
generation.
health awareness session. This kind of sessions will create awareness and that will teach the importance of all these
Correct.
habits, good brushing, and importance of your teeth. And that self-consciousness will come, and that time they will automatically maintain. After teaching kids, now a lot of times parents tell us that now the kid is asking us that mother आपने brush किया कि नहीं रात को. So that kind of change is good, and I think because of your efforts, that will
Hmm.
definitely happen.
Thank you so much. Thank you. So I hope parents, all your queries are solved. And even if you have any query, you can write down to us. We will get in touch with Dr. Dhruva, or you can directly visit his clinic. It's in Bhavnagar, I think in center of Bhavnagar, heart of the city. He has this wonderful cosmetic lab. So you can visit him anytime. But oral health is a must because ये दांत जो है जब तक परमानेंट चले नहीं जाते तब तक उनको
Thank you,
संभाल के
ma'am.
रखना बहुत बहुत
Thank you
जरूरी
so
है.
much. Thank you.
So thank
Thank
you
you,
so
everyone.
much, Dr. Ishan Dhruva, for being with us. Thank you so much.